Hello and welcome to Alleviate Dry Eye. I'm your host, Pam Terrio, or you can call me Dr. T. I am the author of the book Alleviate Dry Eye and also a dry eye specialist here in Shreveport, Louisiana. Thanks for joining me today. I'm so glad you're here because we're going to talk about one of the questions I ask my patients first thing when they come to see me in the office or schedule an online telehealth visit with me. And we're going to talk about it today. So, the first question that I like to ask is, do your eyes feel more tired and irritated first thing in the morning or at the end of the day? And the reason that I like to ask this question, first off, is because I want to get to the root cause of the dry eye symptoms. So, knowing this tells me a lot about the lids, especially if my patients tell me that they have dry eye symptoms worse first thing in the morning. That can tell me one of two things. So, first, if your eyes feel more red, tired, irritated, watery first thing in the morning, it may be because you're not closing your eyelids all the way. What? How would I know, Dr. T? I'm asleep. I don't know if I don't close my eyes all the way when I'm sleeping. So I ask these patients to ask a loved one, have you ever noticed that my eyes sometimes are a little bit open when I'm sleeping? Or have a friend do a quick test. So in order to test this, what you're going to want to do is tilt your head back about 30 degrees and then close your eyes gently like you're sleeping. Then you would just have your friend use a small light or a pen light, even the camera phone light would work, and just shine a light in between your eyelids and see can they see a little bit of white right there or some shiny reflection. And that would indicate that part of your eye is showing while you're sleeping and it's not closed all the way. If that is the case, then your eye is drying out when you're sleeping and it can be very painful. So, what to do about this? It's um, sometimes an easy fix. I would start with doing an artificial tear gel or ointment. So, you can get an over the counter ointment called Refresh PM, Sustain Nighttime, Soothe Bedtimes. All of the brands have an ointment available over the counter of these artificial tears. And then you just take a little strip of your ointment. Let me get this guy open. There we go. Just a little bit of the ointment onto the tip of your finger. Make sure your hands are clean. Look up towards the ceiling and just roll that into your eye. Now you're going to want to make sure that you are ready for bed at that point. You don't want to be still thinking you're going to watch the news or read a book, because once you have that ointment in your eye, vision is blurred out. The next thing you could try is doing a sleep mask over the eyes to help keep the eyelids closed. And the final at-home option would be to go with a sleep goggle like the ones sold at Eye Echo. They have the Eye Seals 4.0 moisture chamber goggles that you can use when you're sleeping at night. I love those for my patients. So why would your eyes not be closing all the way when you're sleeping? There are a few reasons. The first would be that you've had eyelid surgery. Maybe you had some of the upper eyelid bags taken out, that loose skin removed, and now your eyelids don't come to close all the way. The second reason would be that you sleep on your stomach, and so your eyelid rubs into the pillow and maybe is lifting up while you're sleeping. Maybe you have sleep apnea, and that often gives patients will rub their face into the pillow again with sleep apnea, and little eyelids will lift open. Or perhaps you sleep with a CPAP machine, and even though your eyelids are closing most of the way, that air is escaping from the CPAP and kind of blowing up between your lids and drying out your eyes. All right, so that was the first reason why your eyes could feel worse in the morning. The second reason is that you have an overgrowth of bacteria on your lid margin. That is called blepharitis. That's the doctor term for it, an overgrowth of bacteria on your lid margin. So we all have bacteria that live on our lids and lashes, and some of us have an environment on our lids and lashes that is more conducive to these bacteria living and thriving. So you may have this if you notice crusting or flaking in between your eyelashes, if the inner rim of your lid is reddened, if your eyelid margins are thickened, if you itch at the base of your lashes, um, or your eyes are most irritated when you first wake up in the morning. So that could indicate that you have an overgrowth of the bacteria. And the best way to take care of that as a first line of defense is to use a lid and lash cleanser. I love the Zocular brand. This is a foaming eyelid cleanser. And what we would do with this is just pump out a little foam there and rub your two fingers together like this, and then scrub, scrub, scrub right on the lash margins, maybe 20-30 seconds, and then make sure you rinse that off real good. So there you have it. There's two reasons why your eyes might feel worse in the morning from the dryness and irritation standpoint. They would be that your eyelids are not coming all the way close while you're sleeping, or that you have an overgrowth of bacteria on those lids and lashes. So when they come together and stay closed in contact with the front surface of your eye all night long, your eye feels worse in the morning because you're not blinking during the day like you would during the day. So there you have it. If you want more tips on how to take care of your eyes today so your vision will last you a lifetime, check out my website at www.pamterrio.com or schedule an appointment with me online at that same website. Thanks again for joining me today, and I'll see you next time.